Hello everyone, welcome to my class today. Today we'll be seeing the next topic in central nervous system, that is headache. So if you are the first time watching my channel, please subscribe to my channel and click the notification button and also comment if there is any suggestions. So coming to the class, so headache is a common type of pain that is in the head, which is experienced by almost all the humans, and it is mainly caused by excitation of the pain sensitivity structures. So these structures are venous sinuses. So venous sinuses are the venous drainage that is in the brain, in the cerebrum, and dura mater is the outer covering of the brain, and cranial blood vessels are the blood vessels that are supplying to the cerebrum, and the branches of trigeminal nerve, which is a fifth cranial nerve. So when all these structures are getting excited, so excited is when they are getting triggered, and there are some chemical produced from the nerve endings which can trigger the pain, and thereby patient can cause headache. And coming to the types of headache, there are three types. One is tension type. So it is a most common type of headache which is characterized by bilateral location, that is on both the sides of the head there will be pain, and it is of pressing or tightening quality. Okay, something like band, like something is tying on the head and it is pressing the head like that, you will feel the pain, and it is a mild, it is with mild or moderate intensity. Okay, that means the severity may be mild or it may be a moderate type of pain. And next is migraine headache. This is one type of recurring headache. So recurring is it can occur often, well, like it can keep on occurring after a month or after a week according to the condition of the person. Due to any stress or due to any triggering events, the headache will occur, and it is a unilateral or bilateral type. So that means on one side of the head the person may feel the pain, or it can occur in the both the sides of the head, and it is mainly aggravated by the precipitating factors. So precipitating factor may be any stress or any excessive emotions like excessive happiness or excessive grief. Anything can aggravate the headache. And the triggering events, so triggering events can be foods. There are some foods which can cause pain, and also some pharmacological agents like alcohol and other wine, etc., which can also cause the pain. So that is migraine type of headache. And next is cluster headache. So it is one of the rare form of headache, and it is of radiating type. So that is the headache will start from where below the eye, and it will radiate to the cheeks, the mouth, the nose, etc. So like that they will radiate, and these have repeated episodes of headache. Okay, so patient will have the head, like in 1 hour the patient will be keeping on having this headache again and again, and it can also constantly the pain may be constantly present for weeks to month at a time, and followed by remissions. Okay, sometimes the pain may leave, sometimes the pain may come. So like that it will be wavering type of pain. And coming to the causes of headache, so the tension type headache is caused by any intracranial or subarachnoid hemorrhage or masses. Okay, so you know the skull brain is present inside the skull, and the skull is a closed cavity. So any hemorrhage means bleeding or any mass or tumor, if it is present within the cerebral tissue, then they can compress the nerves, and when the nerves are compressed, patient will feel the pain. And any diseases of the eyes, nose and teeth. Okay, so any eyes, nose and teeth, because the nerves are all connected very nearby to the brain. So whenever person is having any disease of eyes and nose and teeth, they can cause inflammation, injury to the nerves, and these neuronal dysfunction and neuronal sensitization can aggravate the pain in the head. And other systemic illness like bacteremia, so this is due to any infection. Again, when there is infection, there is injury, and injury to the nerves which can aggravate pain. And poisoning, so mainly carbon monoxide poisoning and other volatile gases. When the person is inhaling the fumes, this can again cause headache due to the abnormal biochemical reactions that are occurring between the nerves. And mountain sickness, so this is mainly for mountain climbers. When they are climbing high altitudes, then the oxygen level in that area is low, and because of that they can induce the pain. And polycythemia vera is one of the condition where there is increased RBC count in the blood. RBCs are red blood cells. So when there is increased RBC, This increases the concentration of the blood. So when the concentration is increased, again the nerve endings can get irritated, and thereby the person may feel the pain. And other physical status like life adjustment, family situation or environment. So any problem in the family or any stressful situation within the family, this can all aggravate and cause the tension type of headache. And next is migraine headache. So this is mainly caused by hormonal fluctuations. So that is mainly due to some estrogen imbalance in the women during this menstruation time. So this time the person can aggravate the headache. So this is due to the imbalance in the estrogen. And head trauma. So any trauma or any when the person's head is hit somewhere and he is getting a trauma, it can result in migraine headache. And physical exertion. Okay, so when person is tired more, he is doing so much of work and he is fully exhausted, like working under the sun for a long time, and these all physical activity, excess of physical activity can induce migraine headache. And again fatigue. So fatigue is also severe tiredness. This is again due to the excessive work, patient can go for migraine headache. And stress. Okay, so when person is highly stressed, again there are so many hormonal changes which can cause the nerve endings to get irritated, which will result in pain. And pharmacological agents like monosodium glutamate, aspartate, red wine and alcohol. Okay, so these are all some pharmacological or chemical agents which can cause neuronal damage, and thereby they can result in pain. And foods like chocolates, cheese, tomato, orange and onions. Okay, so mainly migraine headache patients, when they take these foods, their pain will get aggravated. So we have to tell those persons to avoid those foods whenever possible. Okay, so that they can prevent the migraine headache. And next is cluster headache. This is caused by dysfunction of intracranial blood vessels. So again, when there is any aneurysm or any infection in the blood vessels, so whenever there is intracranial within the cerebrum, the blood vessels that are supplying, when they go for dysfunction, then the person can go for cluster headache, because there is improper blood flow to the nerves and nerves are getting damaged. And pain modulating systems of the sympathetic nervous system. Okay, so there are pain theories where the sympathetic nervous system is stimulated whenever the patient is feeling the sensitization to pain. So when these pain modulation systems are triggered, then again due to the nervous system triggering, this can cause constriction of the blood vessels, and thereby they can cause the irritation and inflammation to the nerves and result in pain. And genetic component or the family history of headache. Okay, so mostly if any family history of headache is there, then the children also will have the headache, that is cluster type of headache, mostly follows the family history of the genetic component. And smoking and alcohol ingestion. So these are all chemicals which can irritate the nerves, and thereby they can cause the headache. And next, coming to the pathophysiology of tension type headache. So any of the predisposing factors, like all the causes which we have read, like any tumors, any bleeding, so any factors, they can cause sustained contractions of the muscles of the scalp and the neck. Okay, so that is, these muscles will get contracted, so like that the tightening or band like they will contract the head. So because of when the muscles are getting contracted, so the nerves end inside the muscle, so these nerve endings will get compressed. So whenever the nerves are compressed, we will feel the pain. Okay, there will be painful sensitization of the nerves, so they cause the tension type headache. And next, in migraine headache, there are mainly 3 theories which prove the patient is having migraine headache. So first is vascular theory. So that is any of the predisposing factors like any head trauma or any vascular changes. So there will be sudden changes in the vascular systems of the brain. Okay, so that is, there will be sudden vasoconstriction followed by vasodilation. Okay, so whenever some precipitating factors, as I said, any food or any pharmacological agent, so when a person is exposed to those agents, the sudden change of the vascular system will occur. That is, vasoconstriction followed by vasodilation will occur. So there is sudden change in the blood flow. When there is sudden change in the blood flow, the nerves cannot accommodate or adjust to the changes in the blood flow, so they go for dysfunction. So that is called neuronal dysfunction, which can result in throbbing type of pain in the head. So that is the vascular theory which suggests patient may have a migraine headache. And next is muscular theory. So muscular theory is almost like a tension type of headache. So where any predisposing factors, they cause tension in the muscles of the scalp and the head. Okay, so when any factor that is causing tension in the muscles of the scalp and head, there will be contraction of the muscles. Again, when the muscles are contracted, the nerves end in the muscles. So these nerve endings are getting compressed, and when they are compressed, the person will sensitize to the pain. So there will be painful sensation in the head. And then other theory is the biochemical theory. So in this theory, it says that there is a change in the serotonin pathway. Okay, serotonin or the neurotransmitters, and also these serotonin are stored in the platelets. Okay, so the blood component, one of the blood component is the platelets. So the serotonin is stored in the platelets and it is released in the plasma. So there is change in the serotonin pathway which can result in inactivation of the serotonin. Okay, so the serotonin that is released in the plasma will become inactive, and because of the low serotonin levels, that is the serotonin is not functioning actively. So inactivation will result in decrease in the serotonin levels, which will dilate the blood vessels. When the blood vessels are dilated, again the blood vessels, near the blood vessels there are nerves are supplying, and these nerves will get constricted and they will cause the migraine pain. Okay, so these are the theories which suggest the person may have a migraine headache. And next is cluster headache. Okay, so there is a pathway how the cluster headache is formed. So first is due to dysfunction in the cranial blood vessels. Okay, mainly cluster headache is due to some problem inside the cranial blood vessels. There is synchronized abnormal activity of the hypothalamus, trigeminal vascular system and autonomic nervous system. Okay, so these three systems, that is hypothalamus, which is the major part of the brain that is helping in function of most of the activity in the body, and trigeminal vascular system is the blood vessel that is supplying to the trigeminal nerve, and autonomic nervous system is the sympathetic and parasympathetic nervous system that are carrying the impulses from the brain to the peripheral area, that is peripheral body, that is peripheral nervous system. So these area, they are going for a synchronized abnormal activity. Okay, so synchronized abnormal activity is like a circadian rhythm. Circadian rhythm is like due to some changes in the seasons, or some changes in the day and night, or changes in the light, everything. Okay, so this called, so according to the circadian rhythm, okay, that is changes in the time of the day. So like this activity, there is abnormal activity in the hypothalamus, trigeminal vascular system and autonomic nervous system. So these all will trigger the pain modulating systems. Okay, so pain modulating system are nothing but the nerves which are triggering the pain. So when they are getting activated, then there is sensitization of the sensory nerves. So sensory nerves are those helping in feeling the sense. So when these sensory nerves are activated, they will result in cluster headache. Okay, so this is the pathway for cluster headache. And next, coming to the clinical manifestation, diagnostic findings and pharmacological management of tension type headaches. So mainly in clinical manifestation, there will be photophobia, which means sensitivity to light. That is, patient will have the fear to see the light. Okay, so photo is light and phobia is the fear. So when the light is there, patient will have a irritation and feeling of pain. And phonophobia is sensitive to sound. Okay, when there is some excessive sound due to some radio or some musics are playing, so then the patient will feel irritation, or the patient can have a headache. That is called phonophobia. And head and neck tenderness. Okay, that means the patients will have stiff neck, and the head also will be stiff and tight in case of tension type headache. And coming to diagnostic findings of tension type headache, so mainly we will do a history and physical examination, which can reveal patient will have an infection or a tenderness or swelling in the head. And electromyography, okay, because in tension type mainly the muscles are getting activated or constrict, there is increased contraction of muscles. So to identify the muscular contractility, we do a electromyography study. So electromyography is nothing but they place the electrodes in the muscles of the head, that is on the scalp, and then there will be taking like a ECG, there will be a graphical representation of the muscular function will be coming in the printed paper. So from that you can identify how much muscles are functioning. Okay, so electromyography will reveal the sustained contraction of neck, scalp and facial muscles. Okay, so to identify this we do a electromyography, and other routine analysis, routine laboratory studies we do, like CBC is complete blood count, where you will be seeing the hemoglobin levels, RBC, WBC, platelet levels, and serum electrolytes. So this is for this is to identify the nerves function, because nerves also function with the help of electrolytes. So we have to see the sodium, potassium, magnesium, chloride and potassium levels in serum electrolytes, and urine analysis will be done in order to identify whether the chemicals, everything are released, that is the unwanted chemicals in the body are excreted in the urine. So these are the diagnostic findings we do. Next is pharmacological management in tension type headache. So first we have to administer non-opioid analgesics. So non-opioid means those that does not cause abuse. Okay, so there are some opioid analgesics which are more potent and patient can abuse that. So non-opioid analgesics or simpler form of analgesics, one is aspirin, brufen, acetaminophen. Okay, and other analgesics also given, that is fiorinol, Fioricet and Midrin. So these are all combinations of analgesic. Okay, there are 2-3 drugs mixed and they give these drugs. So they are mainly to relieve the pain, and tricyclic antidepressants. Okay, so when there is so much pain, patient will go for depression, and there will be problem in the nerves, that is the chemicals which are transmitter, that is the neurotransmitters are also getting triggered. So in order to prevent that, they give a tricyclic antidepressant, that is doxepin and amitriptyline. And beta adrenergic blockers will be given. The drug of choice is propranolol. This is to decrease the, this is to block the beta adrenergic fibers in the vascular system. So these are the pharmacological management in tension type headache. And next, coming to migraine headache. So the clinical manifestations in migraine headache is aura. Aura is unilateral throbbing pain that will be lasting for 10 to 30 minutes. Okay, so that is a period where you can see the pain is lasting for a 10 to 30 minutes, and patient will have sensory dysfunction like visual defects, tingling or burning sensation and paresthesia. Okay, paresthesia is nothing but numbness in the body or in the legs. The person may feel the numbness. And then motor dysfunction will be there, so that is weakness, so weakness of the body, and paralysis. So paralysis is loss of function of any extremities. And patient will have dizziness. So dizziness is something like vertigo like feeling, where he will be losing the consciousness, and confusion or loss of consciousness will be there. So these are the stages of loss of consciousness. And generalized edema, so there will be puffiness, swelling in the face, and also swelling in the extremities. And irritability, so because of the migraine is a recurring type of headache, patient will be always irritable. And pallor, so this is due to the abnormal blood flow, that is, I said in the theory there will be a vasoconstriction followed by vasodilation. So because of the patient will go for pallor. And patient will have nausea, feeling, vomiting, sweating, so and psychic disturbances. Okay, so patient becomes mad and irritated because of the intense pain. And change in fluid, GI upset. So during the pain, patient may also have indigestion or feeling of diarrhea and other nausea, vomiting, and something gastric irritation will be there, like pyrosis feeling will be there in the GI system. And changes in the fluid balance, this is due to edema and other thing, the fluid balance may change. and hibernate. Hibernate is patient will feel irritated, somewhere he will go and hide himself. Okay, that is called hibernate. That is, he will seek shelter from noise, light, odor, or people and problem. Okay, so when the person is exposed to excessive noise, light, odor, he wanted to get free from that. That is, he wanted to avoid those things, so he will go and hide somewhere. That is called as hibernate. Okay, so these are the clinical manifestations seen in migraine headache, and the diagnostic findings are in history and physical examination. You can identify what are the triggering factors. So as I already said, it can be caused by food or some pharmacological agents or any stress, fatigue, exercise. So you can identify what factors have triggered the migraine headache, and you have to do a CT scan with or without contrast. Okay, contrast is nothing but a dye will be injected and then they do a CT scan. So this dye will go and color the arteries, so that you can identify clearly if there is any trauma or any hemorrhage, bleeding can be identified. So CT scan with or without contrast will be done to evaluate the trauma, and also if the CT scan is not so clearly visible, then they will go for a MRI scan, which is a more potent type of scan. Here you can also identify if there is any cerebral abnormalities, and other routine studies like CBC's, complete blood count, serum electrolyte, and urine analysis will be done. And next is pharmacological management in migraine headache is serotonin receptor agonist. Okay, so I said in the pathway, that is biochemical theory, there is a problem in the serotonin activation. So the serotonin will become inactive and it will be low. So we have to replace the serotonin receptor agonist. So that is almotriptan, elytriptan, frovatriptan, naratriptan, risatriptan, sumatriptan, zolmitriptan. So all triptans are serotonin receptor antagonists, so that can be administered. And alpha adrenergic blockers like ergotamine tartrate and dihydroergotamine will be given. So these are all, again, they will act on the autonomic nervous system, and they will help in the increased blood flow, thereby it will help in reducing the pain. And analgesic combination, migraine can be given. So this has a combination of many analgesics, and that drug will be given. And corticosteroids are given. So if there is some inflammation and injury due to trauma, then it can be treated with corticosteroid, that is dexamethasone. And beta adrenergic blockers, propranolol given. So these act on the vascular system, that is vascular nerve fibers, they will act, and thereby they will relieve the pain. And antidepressants, amitriptyline and imipramine. So again, when there is pain, patient will be depressed, so to treat the depression they give amitriptyline and imipramine. And serotonin antagonist, that is methotrexate, will be given, and calcium channel blockers will be given, so verapamil. So these are all to prevent the, so whenever there is headache and other things, these calcium will come out of the blood vessels and they can accumulate on the brain, and they make the brain cells to become stiff. So to prevent that, they give these calcium channel blockers. Okay, so these are the pharmacological management of migraine headache. Next is cluster type headache. So here the clinical manifestations are intense pain which will be lasting for 1 hour. So there will be some period of pain where the pain will be severe and it will be having remissions, and this pain will be over a week or month for the person. Okay, and pain usually it is a radiating type of pain, so that is, it is locating around the eye and it will radiate to temples. Temples are behind the ears, and they go to forehead, cheeks, nose, and gums. Okay, so in these areas the pain will radiate, and patient will have swelling around the eye because of the radiation of pain, and also there will be increased secretions coming from all the structures. So there will be swelling around the eye, and lacrimation is tearing, so the patient will feel like he will be crying and putting out watering from the eyes. And facial flushing or pallor. Okay, so the facial, there will be redness in the face, or it will be changed into a pallor. Okay, so this all because again fluid will extravasate from the blood vessels. And rhinorrhea is running nose, where patient will put out so much secretions from the nose. And pupillary constriction, so again patient due to intense pain and other irritability, patient's pupils will get constricted and patient will be agitated and restless when the patient is having pain. And diagnostic findings, we have to tell the patient to maintain a headache diary. So headache diary means you have to tell the patient to maintain the time, that is when the pain has started, when the pain has stopped, and what factor that caused the pain. Okay, so before pain, what was the activity patient was doing, what food the patient was eating, so and what activity reduces the pain. So all those diary has to be maintained for a month by the patient. Okay, so then from that we can identify what is the cause and why is the pain occurring. And CT or MRI will be done to rule out intracranial disorders. So any brain disorders are there in the cranial nerves or in the cranial system, in the cerebrum, then you can do a CT MRI. And MR angiography will be done to rule out any cerebral aneurysms. Okay, aneurysms are nothing but outpouching in the cerebral blood vessels. So when there is outpouching, again they can compress the nerves and there will be pain. So they do a MR angiography. So in angiography they inject a dye and they send a dye, and the dye will go and perfuse all the blood vessels, and this will be seen in the fluoroscopy screen. So when there is an aneurysm vessel, the dye will be present in the aneurysmal area, so that area will be dilated. So this you can identify in the MR angiography. And then other routine laboratory studies like complete blood count, serum electrolytes and urine analysis will be done to identify any disorders. And pharmacological management, so mainly they give alpha adrenergic blockers, that is ergotamine tartrate. Again this will block the nerve fibers, that is causing sensitizing the pain. And serotonin antagonist methysergide will be given. And calcium channel blockers, verapamil and lithium is a drug of choice to reduce the headache. And corticosteroids like prednisone will be given. And again these cluster type of headache, patient may have decreased oxygen, so we can also provide oxygen therapy for these patients. Another collaborative care is you have to identify the precipitating factors and avoid them. Okay, so tell the patient to avoid all the precipitating factors like any stress or any excessive exercises, any emotional things or any food. So whatever is the precipitating factors, you have to avoid them. And tell the patient to do daily exercises like mild walking or something. When the patient is not having pain, he must do some exercises or any relaxation therapy. So relaxation is hearing music or doing some type of work which will help the patient, that is reading books or something where the patient will be mind will be free from the pain. And socialization is nothing but maintaining relationship and talking with people so that the patient will forget about the pain. So these all will help to decrease the recurrence of headache. Okay, next tell the patient to do meditation, yoga or any self-hypnosis. So these are the techniques can help in handling the headache. Okay, so meditation is like prayer or doing some prayer. Yoga is doing some yoga related exercises. Self-hypnosis is patient should sit comfortably in an area and he can just look above the ceiling and take a deep breath, or he can something count 1, 2, 3, 4, 5 or do some. Okay, next is symptomatic relief with drugs must be administered. So we have seen the different types of pharmacological management for each type of headache. So you can tell the patient to take those drugs as advised by physician. And in case of migraine headache, you have to advise the patient to sit in a quiet and dim light environment so that the patient will feel relaxed and the pain will be coming down. Okay, so excessive light or excessive stress will aggravate the migraine headache. So tell the patient to sit in a quiet and calm environment. And massage with balm or any moist hot packs can be given to relieve tension type headache. Okay, so like balm, you know there are Jandu balm, Tiger balm or so many Vicks and other resins are there where you can tell the patient to massage with on the forehead so that this can relieve the pain. And moist hot packs, okay, so that is like hot water. You can tell the patient to put the cloth in a hot water and then he can apply it on the head. So like they squeeze it and apply it on the head. So these all will help in relieving the tension type headache. And in case of migraine headache, tell the patient to avoid the foods that are triggering the headache. So like tell the patient to avoid chocolates, oranges, tomato, cheese, onions, red wine, alcohol, caffeine, marinated foods. Okay, these can trigger migraine headache. So tell the patient to avoid those foods. And avoid exposure to smoking and other volatile gases like strong perfumes and gasoline fumes. Okay, so these can also aggravate the headache. So tell the patient to avoid those, avoid exposure to these gases. Okay, in case of cluster headache, patient may need oxygen therapy. So at hospital you can give an oxygen therapy for the patient. So because in cluster headache there will be decreased oxygen, and especially if the patient is doing an air travel, there is again in the high altitudes the patient can go for lack of oxygen. So patient in air travel, you have to tell the patient if he needs oxygen he may use the oxygen in the air. And also before taking off, okay, before going in the airplane, he must take the tablet ergotamine tartrate to prevent the headache during air travel. So these are the collaborative care for headache. I hope you would have understood the class. Thank you for listening. Please like, share, subscribe and also comment and click the notification button for regular updates of my video. Thank you.